At Integrity Advisors, we focus on service first and always with integrity. Our goal is to be an advocate for our clients' healthcare needs, so they get their medical care and pay no more than needed. Our education-first approach is why we created our video library. We hope you will enjoy learning, and these topics help you stay healthy while saving time and money when using your medical benefits. Please feel free to contact us with further questions. Welcome to our Video Education Healthcare series. This video is on Medicare Part D, which is commonly known as prescription drug coverage. This video will explain how Part D has multiple areas which include eligibility, the late enrollment penalty, important terms to know, and we will also explain how Part D coverage actually works. To be eligible for Part D, you must be enrolled in either Part A or Part B, or both Parts A and B. Medicare does not administer Part D benefits, but they do set the guidelines that all prescription drug plans and health plans must adhere to. Medicare allows certain health plans to offer Part D prescription benefits through their Medicare Advantage plan. When you enroll into a Medicare Advantage plan, it will often have a prescription drug plan included. These plans are called MAPD plans. Many health plans offer a standalone Part D prescription drug plan, which is purchased by consumers on Medicare, but those not enrolling into an MAPD plan. These prescription-only drug plans are also called PDPs. Understanding Part D may be one of the more challenging aspects of Medicare. Please take some extra time to review this portion of our Medicare Education Healthcare series. Part D only began in 2006, and prior to 2006, prescription drugs were not required to be covered by insurance or by Medicare. Today, all Part D plans must meet standards and have the same basic benefits as required by the Centers of Medicare and Medicaid Services, also known as CMS. The monthly premium for Part D plans can vary based on your Part D plan selection and household income. Since Part D coverage is only 12 years old and still fairly new, you can expect that all parts or stages of Part D coverage will change each year. Where most people tend to trip up is on the different stages to a Part D plan. These stages are created and standardized by the Centers of Medicare and Medicaid Services, or CMS. The coverage is more generous with various Part D plans, but all Part D plans must have coverage that is no less than what the CMS determines as the standard. The 4 Part D plan stages include the deductible stage, the initial coverage stage, the coverage gap, and the catastrophic stage. Let's review Stage 1, the annual deductible stage. The deductible stage is comprised of satisfying the annual deductible amount, which can change year to year. In 2018, it is $405. You must meet the annual deductible before your Part D plans pay for any of your prescription drug costs. The deductible amount will change each year, so it is important to review your benefits annually. The initial coverage stage gives members an annual dollar amount to use towards their cost of their medications. The annual amount in 2018 is $3,750. This dollar amount can be used towards the cost of your medications. The annual amount is comprised of the member's copays, co-insurance, and what your drug plan pays. The Part D plans will predetermine which of your drugs have a copay or a co-insurance. Your copay will be a fixed dollar amount and your co-insurance will be a percentage of the full cost of the drug. If you exhaust your annual dollar amount down to zero, then you will enter into the next stage, which is called the coverage gap. also known as the donut hole. Most people do their best to avoid this stage due to the fact it is your responsibility to pay a larger share of the cost for your medications. In the donut hole, you pay 56% of the cost for generics and 35% of the cost for brand names. You remain in the donut hole until you have spent enough to reach the out-of-pocket total of $5,000. After you reach the out-of-pocket cost total, you then enter the last stage, known as the catastrophic coverage stage. If you reach this stage, your cost for all of your medications is reduced significantly. You pay $3.35 for generics or preferred multi-source drugs. For all other drugs, you pay $8.35 or 5% of the cost, whichever is greater. Please review your updated benefit amount each year on www.medicare.gov. Part D plans may have different coverages, but they will all certainly require you to know these key terms. Formulary. A formulary is a list of prescription drugs, and each insurance carrier who offers a Part D plan has a formulary. All formularies include both generic and brand name drugs. Not all health plans cover the same drugs on their formulary. Copay. A copay is the amount you share of the cost of a prescription. The remaining cost is paid by the healthcare plan. Tier. A tier refers to the groups in which drugs are categorized. Copayments are determined by each tier. Mail order. Some health plans offer the option to get your prescriptions mailed to your home. Discounts may be offered, such as receiving a 3-month supply for the cost of 2 copayments. Step therapy. In some cases, health plans will require you to try a more cost-effective alternative drug before covering a more expensive drug of that same condition. Medication therapy management was created in 2006 and is required by all Part D plans. The program is intended to help you and your doctor make sure that your medications are working to improve your health. If you qualify for therapy management, there will be a pharmacist or health professional available to you that will give you a comprehensive review of all your medications and talk with you about the following: how well your medications are working, whether your medications have side effects, if there might be interactions between the drugs you're taking, whether costs can be lowered, or if you're having other problems. The ultimate goal with the Medication Therapy Management Program is to develop an action plan so that your medications work best to maximize your health. Like Part B, Part D premiums may change based on your household income. However, Part D premiums are generally determined by the Part D plan you choose to enroll in. If you are a high-income earner, there will be an additional premium you will pay on top of your Part D plan premium. Each year, Medicare will evaluate your past tax returns and establish your Part D premium for the current year. Please note, Part B premiums are either deducted from one's Social Security check or paid directly, while Part D premiums are paid directly to the insurance carrier. When you become eligible for Medicare, you must select a Part D plan, not only to be covered for your prescription drug costs, but to avoid a late enrollment penalty. The cost of a late enrollment penalty depends on how long you went without a Part D or without creditable prescription drug coverage. Medicare calculates the penalty by multiplying 1% of the national-based beneficiary premium times the number of full uncovered months you did not have Part D or creditable coverage. To give you an idea of the cost of a Part D late enrollment penalty, here is an example of the penalty math. Mrs. Smith is currently eligible for Medicare, and her initial enrollment period ended on May 31st, 2015. Mrs. Smith does not have prescription drug coverage from any other source, and she did not join by May 31st, 2015. Instead, she joined during the open enrollment period that ended December 7th, 2017. Her drug coverage was effective January 1st, 2018. Since Mrs. Smith was without creditable prescription drug coverage from June 2015 through December 2017, her penalty in 2018 was 31% of $35.63, or $10.86 per month. Since the monthly penalty is always rounded up, she paid $10.90 for each month in addition to her plan's monthly premium. This video is part of our Education on Healthcare series. We hope this was helpful. Remember, we're here for you. Our clients can access our world-class Sage Concierge advocacy for their healthcare, so they pay no more than needed for the care that they do need. If you liked this video, please do like the video and share with your coworkers and friends. Thank you for taking the time to watch our seminar on Part D prescription drug coverage. For more information on Part D prescription drug coverage, please do not hesitate to reach out to us at 1-800-500-9799.